I shall do my level best to answer them. Now, I have got some that have already been asked. So if you haven't got any questions, then that's absolutely fine. I'm going to assume everything's working in terms of the audio and all that stuff. Short of holding up a sign saying, is the audio working? Which, if I'd planned, I could have actually had one. Could go on laminated, couldn't I? Oh, here we go. Hope you had a great week off. Yeah. Gotta be honest, didn't do much / anything for the week off. The children had stuff on. I wanted to. I desperately wanted to go away, but the children had stuff on Monday, Tuesday, Wednesday, and then it was bank holiday Thursday, Friday. So, anyway, we're looking for the summer holiday, maybe doing something. But there you go. But yeah, I hope you had a good week off as well, Corinne, or at least a weekend off, or at least a long weekend. So I've got a question here, if you don't mind. Hey, oh, look, I can heart that. I'm going to heart that. There you go. I like that comment. Can we remove a lipoma via liposuction? So short answer is yes. We can remove a lipoma via liposuction, but you've got to ask yourself what is it's quite a sort of niche indication for it, because liposuction equipment is expensive. Liposuction equipment requires more anesthetic. So I wouldn't do liposuction under a pure local anesthetic. So that would require either local sedation or a general anesthetic. So that's a bit more of a bigger deal. So you've got to ask yourself why you're having it done. So I haven't done it very often, to be honest with you, but thinking about it, the times I have done it, I can think of one time in particular was a very large lipoma on a shoulder. And the problem with doing it by excision, by cutting it out, would have been that I'd have given a big scar on the shoulder. And the shoulder's a very bad place for a scar. It's got a high risk of hypertrophic scarring. So that was in a bad place for a scar, and it was very big. So, that those are the sort of, I guess if you're thinking, why would you remove a lipoma by liposuction? I guess if it's very big in a bad place for a scar, I guess that would be the criteria. Thinking about it on the hoof, what are the criteria for removing a lipoma by liposuction? I mean, the standard way of removing a lipoma for those of us that don't know, I say us, I do, so you, is a fatty lump. Basically, it's a lump. It's a benign lump of fat, which is in an area. So it's a lump underneath the skin, and they can be annoying. And normally you would just cut it and take it out, and that they're relatively simple to remove. Well, I mean, they can sometimes be a bit more difficult, but anyway, we won't get into that because that's my problem. So I don't want you to worry about it. Okay, let's just say they're relatively simple to remove, but the normal way of removing is by cutting them out. But you can remove them by liposuction in certain circumstances. The thing about liposuction, I guess, the two things are: it'd be a bit more expensive, and also it would not allow you to send it to histology. So you'd probably want to be pretty sure that it was benign and what have you. So you might want some imaging prior to removing it by liposuction, although of course imaging will not necessarily 100% tell you that it's benign, but it can give you an idea, and certainly if there's any worrying or suspicious features, you might be a bit cautious about it and might want to biopsy or something at first. Bex is in the house. Bex, how you doing? Where was you last week? I tell you what, Bex, I was on holiday last week, but I didn't do anything, so arguably I could have done it. But do you know what it's like when you're on holiday? It's like when people say, they want to go back to work and say, look, I don't do much, after surgery. I don't do much at work. But it's just the fact that you're getting in your clothes for work and you're getting your car dry. Even if you don't do much, it's a big deal. And I find that about it on the Tuesday. I get, so that's what I did. I said to them, I'll, cancel it on Tuesday because I thought I might be a bit stressed about it, I might think, oh God, I've got to remember my Facebook Live. So I didn't do it last Tuesday, but I was actually here. I wasn't away. So I guess I could have done it, but I just thought, no, I don't know what I did in the end. I think I watched a film with my son. Yeah, that was a bit on the edge. 15 it was, but I mean, the authorities watching, he's 14. It is a 15, but honestly, it's a bit embarrassing in several places. And I thought, is that 15? I mean, what's an 18? What's the criteria for 18? Because as far as I'm concerned, anyway, that's what I did. So, Bex, what you got? My daughter has a massive one on her hand. What, a lipoma on her hand? I mean, I say it like that. You can get a lipoma anywhere on the body, so it's not that it's not outside the realms of possibility, but it's an unusual place for it, Bex. It's a lump. So, I mean, there's lots of reasons for a lump on the hand. Now, a lump on the hand, probably my go-to, my number one, Bex, would be a ganglion. Is it around a joint? So if it's around one of the joints, then a ganglion would probably be the first one, or it could be a lump on the tendon or one of the pulleys that the tendons are held under. So I think lipoma wouldn't be high on my list of that, but not outside the realms. I'm okay, lol, good to relax. Yeah, it's okay here with us now. Yes, I am. Lorena, love you big time, Lorena. I'm going to see you tomorrow. I hope you're well. Ganglion. Yeah, back the ganglion. If it's on a joint, ganglion. Difficult to remove that one, Bex. Again, well, not difficult to remove. Back of hand. So is it like here, dorsal on the back of the wrist? Not difficult to remove so much as difficult to remove and not make it come back again. That's the problem with ganglions. They can come back again because they're little pulsion diverticula of the joint. They're a little outcropping of the joint, and they can come back again. Traditional is the Bible. People talk about hitting it with a Bible to make it burst, but they can come back again. So yeah, tricky one. Corin, but that was awkward. I've got to be honest with you, Corin. It was awkward. I mean, there was frank, should we say, romantic episodes in the film, as well as violent episodes in the film, and I was cringing. I don't know what he has been exposed to. I might sound like a bad father there, but I don't know. Maybe he thought it was all right, but I just think 12's a bit too, Because my other son's 11, so obviously I watched 12s with him. But I thought, because it was just me and the 14-year-old, because the other one was on a sleepover. I thought, let's watch this. Ryan Reynolds it was as well, which I thought was, he's quite sort of childish, not childish, but and it just shows you how wrong you can be. So be careful out there, guys. If you're going to watch a 15 with your 14-year-old, be careful because it could be orcs. Certainly was for me. What you got, Bex? Yes, I'm back. My mum used to say, "Bank a heavy book on it." Yeah, that's it. It's the Bible for some. I don't know why. Yeah, heavy book it would do. It doesn't have to be a Bible. Gaynor, what you got? Gaynor, I worked with you many moons ago in the NHS. I am considering breast reduction surgery by you and only you. Oh my God, could you explain how implants could be used? What I perceive as better aesthetics. Yes. So, Gaynor, good to see you again. Look at that, many moons ago in the NHS. Those are the days, eh? So, Gaynor, I don't know. I've got a question about this here. So, here we go. This one here might have been from you. Can I have breast reduction and breast implants? That might have been yours. So, I'll tell you, Gaynor, let's keep it simple. Let's strip it back. Strip it back to first principles, right? Breast. Two things can be wrong with it. Size, shape. Size can be too big or too small. Shape can be too droopy. So two options for size. As I'm talking, I'm picturing, if there's any graphic designers out there, I'm picturing an infographic, I'm picturing it as I'm talking. I need to make a note of this because this is gold, right? This is the whole of cosmetic breast surgery done, right? too big, too. If you want to be a plastic surgeon doing breast, this is all you need to ask your patients: is it a problem with the size or the shape, or both? If it's a problem with the size, are they too big or too small? If it's a problem with the shape, well, that's only one thing: it's too droopy, basically. So, so what we got? So, I did have the algorithm before. The algorithm before, Corinne, is similar. It's a problem, Corinne. You've been on it too. The algorithm before was lift with implants. The algorithm before I was talking about was a bit different because I have got another algorithm in my head. Again, we haven't got that one out either, but this is a different one. So this is Gainer. What I'm thinking, if you want a breast reduction, your breasts are too big, and the shape is usually a problem as well. They're usually too droopy. So therefore, it's a breast reduction. That's what you need. Maybe it is actually, Corinne. Maybe it is. Maybe I might fall into that same algorithm. But so in terms of on paper, Gainer, you need a breast reduction. That's it. Full stop. You do not need implants. The reason people need implants is their breasts are too small. So implants, when you strip it back, are good at making the breast bigger. So if you say, what do you think of the size? You sound too big. That's it. You're out of the implant arena. You're not in the implant arena. You're in the breast. You're either saying they're okay and they're droopy, in which case you need a breast lift, or you're saying they're too big and they're droopy, in which case you need a breast reduction. So implants are not in the arena. However, people do talk about implants in the same terms as terms of having a breast reduction. And the reason for that is that when you have a breast reduction, you have to be aware of the shape that you can achieve. Because whilst it is always up here when you first have it done, it's always like they're underneath your chin, which you might like, they always settle. And they always settle to have a bit of a concavity in the upper pole. And when people talk about having a boob job or having, breast surgery, having their breasts sort of done or whatever, they have this image in their mind of what a pert pair of breasts looks like. And having a breast lift or a breast reduction does give you a pert set of breasts, but it gives you a pert set of natural breasts. And natural breasts, when you take your bra off, have not got a convexity in the upper pole. They are not full in the upper pole. When you take your bra off, natural breasts will settle to have that sort of shape. That sort of shape to the nipple, and then so concavity at the top, then convexity at the bottom. That's a natural shape of a breast. And what people have in their mind when they talk about having their breasts done is the image in their mind of breast implants. Breast implants can give you that sustained fullness in the upper pole, that convexity in the upper pole. So you have to be prepared. If you're having a breast reduction, yes, they'll be lifted, but the shape will be natural. And that's why I will show you photos and say, look, what do you think? That's the shape. And you might say, look, that's fine. Or you might say, hold on a minute, they look a bit droopy to me. I'm like, well, they're not droopy. That's what the breasts look like. Look at the before and after. They're significantly less droopy than they were before. But the shape does settle in the upper pole. And I've got to be honest, this is out of a bra. So in a bra, push them up and you do all sorts. But out of a bra, you've got to be happy with that shape. Now, if you're really not happy with the shape, some people do talk about using implants just to give shape. And as I say, in a purist sense, I think implants are really good at the size. That's the main reason for having implants, for the size, because they're too small. I wouldn't take on the risks of implants just for shape personally, but people do. So people do talk about putting implants in to give that fullness in the upper pole. So if you're really not going to be happy with that, you can use implants to give, as you say, better aesthetics. But the problem is you're running into potential risks when you use implants. Rippling, feeling the edge, seeing the edge, malposition, them not sitting right, capsular contracture in the future, ALCL, very rare cancer associated with implants, breast implant illness. There's all sorts of potential risks. Now they're quite low, the risks, but they're there and you have to know about them. And the other problem with implants in this circumstance is that the implants will make your breast bigger. And you are having a breast reduction, so you don't want your breast to be bigger. So therefore what you have to do is you have to over reduce the breast in order to replace some of that volume with implant in order to give you a shape. And I've always said I don't feel good about that personally. I mean, we can talk about it on a one by one basis, but I would say to you, I wouldn't particularly recommend it. I wouldn't take out healthy breast tissue and then replace it with implant. I think if you're unhappy with the size, then implants, yes, will make it bigger, and you've got the shape benefits as well. But to have them just for the shape benefits and actually to remove healthy breast tissue and then replacing it with implant. So I think what it needs, Gainer, is a discussion basically about whether you're going to be happy with the shape that can be achieved with the breast reduction. And we're going to get that infographic done because it's golden. I think you'll agree. I mean, I've made it so clear there. I think it needs to be. I think we need to move forward with that because that I'm sure does make it crystal. So I hope that's been crystal. But it'd be lovely to see you again, Gainer. And by all means, yeah, come on, we can rap about it. My 27 and 23-year-old daughters won't watch with me. Well, you're lucky, Bex, because you won't be subjected to what I had to go through. Droopy, size, too big, too droopy. Yeah, that's usually. So that definitely will make them less big and less droopy. The question is, will they make them less droopy enough? Will the droopy improvement be enough for you? That's the big question. You drew it out for us. I did, Bex. And you know what, Bex? I've lost that piece of paper. But if someone finds that piece of paper in my office one day, you know, in years to come, that'll be worth a lot of money because that'll be the original of this thing that all, you know, everyone will be using in years to come. And then, crikey, that's that guy that used to do that thing on Facebook and Instagram and all that. And he used to he drew it out. And that's the flipping, we need a name for it. That's the thing, we need a name for it. Have to think about that. Size, droop, dries, soup. Yeah, size and droop, soup. The soup equation. Soup. I shouldn't be verbalizing this because this is all copywriting stuff, guys. Because I should be making a note of it and talking to my people about it because honestly, this could be the start of something big. Anyway, I'm losing control. What's happening? Too big, too droopy. Got that. Drew it out for Bex. You will have enough breast tissue to use. No implant. There you go. Bex says no implant. Jane, good evening. Jane, good evening. How are you? Portugal #1 fan. Jane is my #1 fan in Portugal, and that is saying something, Jane, because there's a lot of those Portuguesers out there who are big fans of me. So, Jane, do you remember who was the Portugueser? Do you remember the Portugueser? Who remember? Answer me. You remember the Portugueser? What was that? That was on Big Brother or something. Anyway, lovely to see you, Jane. Hope you're doing well. Lovely to see you here. Wonderful of technology that we can all be here together. I want tiny when I have mine with free nipple graft. Mine have turned under now, nipple, due to weight loss. They are flat. Have to roll them up to get them in bra. Whoa. Gainer, thanks for that. Really help. I just need that clarifying. And implants are not part of my plan anyway. Yeah, I wouldn't go down there, Gainer, personally. Bex, how soon is best to have a consultation to decide on reduction? Our consultations free. You can have a consultation whenever you want, Bex. Because if you want to lose weight and stuff, we don't charge for follow-ups. So are consultations free? No, they're not. But what you pay for the first one, basically, and then all subsequent ones will be free. So you pay one fee, and then that covers everything. Call it the clinic passport. Another thing that I wanted to run with, but I don't know how well we run with that, actually. Yeah, rather than calling it a consultation, we call it the clinic passport because you... but anyway, yeah. So, yeah, you pay for the first one, Bex. So much going on up there. We got the clinic passport. We got the soup equation. Honestly. Hi, Donna. Good to see you. Jane remembers that drawing. There you go. I don't. Was it like I can imagine. I can envisage it. God knows where it is. Probably fallen into enemy hands. What's going on in Instagram world? Oh, God. You've got the algorithm before. What is seroma after tummy tuck? Seen a few posts saying they've had this. Lifeguard Sarah. So seroma after tummy tuck. Seroma is wound fluid. So if you are interested in this sort of thing, Lifeguard Sarah, if you have, I suppose it's a bit late by the time you've had your tummy tuck, but if you, when you have your tummy tuck or your surgery, I mean, personally, I use drains, which got tubes, which go into bottles, and blood comes out from the drain, which is like red. And then after a day or so, it turns into this yellow stuff, which is wound fluid. You know, like when you graze yourself and you get that yellow stuff and it gets all crusty. Yeah, that's serous fluid. That's wound fluid. That's fluid that's created by the wound. And the problem with the tummy tuck is there's a space. See, that's the problem. That's why seroma is a problem with tummy tucks, because there's a space, there's a dead space. Because when we do the tummy tuck, we take a big bit of your lower abdomen away, but we cannot close your abdomen without undermining. So we have to undermine all the way up to your rib cage, not only to release the skin so we can close it, but also so we can repair the six-pack, the rectus muscles. So that creates a space. And the worry is that the fluid is going to collect in that space. And that is what a seroma is. So when you have a tummy tuck, there's a risk of seroma. And seroma is like fluid sloshing about. And it's just watery fluid. It's not blood. So blood's a hematoma. Blood will happen the day of the operation. Blood happens earlier on, the hematoma. It's a few days or a week or so afterwards. And the problem is when you drain a seroma, it can come back again because the space is there, and it can come back again. It's one of the main reasons actually that I use drains. I still use drains. I'm trying to go away from it, as I think it's quite normal for people to be moving away from drains, but tummy tucks is one that I still personally do use drains, although I'm quilting now and trying to reduce my drain usage, but still I do use it for tummy tucks because of that space, because we need to let that space heal and stick down. So because once the wound fluid collects there, there's always a space. So we can put a needle and drain the fluid off. It's not that difficult to treat a seroma. We just do it in the clinic. You just put a needle in and drain it off. And often the sensation of the skin's abnormal, so putting a needle in and draining it off, it doesn't actually hurt that much. But because there's space there, it can collect again, and you can be back in the clinic the following week and we have to drain it off again. And so it can be a nuisance. It's not a disaster, but it can be a nuisance, and it's a risk with tummy tucks. And it's just basically wound fluid collecting in the space. I won't be too worried about it if you're having a tummy tuck. It's a nuisance complication rather than a sort of significant thing. It's rarely a significant thing. Looking forward to seeing you tomorrow for my mummy makeover consultation. The Mara Diaries is in the house. Can't wait, the Mara. 5.5 hours round trip. I hope you have coffee. We have coffee. Listen, Mara, we have coffee. Come on. Do you think we don't have coffee? Hey, I got 5.5 hours in the clinic. All right, we need coffee. You and I both. We'll have a coffee waiting for you. Don't worry. Abs, hey, I was wondering how long after baby do you have to wait to have a tummy tuck? Not so much to have, but I would advise, Abs, a year. 6 months is the minimum. A year is the is advised. So 6 months is a minimum. A year is advised. So I advise a year anyway. Some people will do it after 6 months, but I think you're still getting on your feet, and you have a 6-month-old child as well. So I think it can be difficult with 6 months because you're getting on your feet. Your tummy might still be recoiling and things. So you 6 months to a year. I think a year I think is better. I know some people want to have it done sooner because they're on maternity leave and stuff like that. So we can discuss that. But a year is probably where I will be going. Right. Remember that drawing. Fluid seroma. Thank you. Please can I ask if blood loss is ever so severe that a blood transfusion is needed? Yes, it is, Donna. Very rarely. I'm trying to think how many times I've transfused somebody. I mean, in my life, for cosmetic surgery, it's going to be less than, it's going to be fingers of one hand. It happens very rarely. So if someone has a hematoma, I mean, it's not that, I guess in the scheme of things, it's not that uncommon. It can happen. So it's got to be a bigger op, something like a bigger breast reduction than a tummy tuck. It's got to be that sort of op. Something like a breast augmentation would be very rare to need to transfer. Someone having a breast augmentation, breast lift, very rare, but a big breast reduction, a big tummy tuck, particularly if they bleed, have a hematoma afterwards, you might look at suggesting a blood transfusion, but it's not that common. Ella, hello, it's me. Now, who is this Ella? Right, I hope this Ella is not who I think it is, because if it is, I'm going to be having words. But if it's someone else, then Bex, do you still doing surgery? When you're doing surgery in Birmingham again? Bex, I've got to be honest with you. Can you see this? See these bags on my eyes? I've been up to Liverpool, just gone Monday, Tuesday. Just got back today. In fact, I had to lie down when I got home. Right, can I block this person? This right. Anyway, just going to ignore. Right. So yes, I am still doing surgery in Liverpool. I tell you something, Bex. Don't hold your breath. I would love to be doing surgery in Birmingham again, but the hospitals are not giving us consistent theatre space to the extent that we are pretty much just doing it in Liverpool now. And I don't know when we'll be doing it in Birmingham again. I don't know what's going to happen to the whole fabric, the whole way of providing private healthcare. It might change. I don't know. It might not, but certainly they don't seem to be very focused on plastic surgery, and it has been extremely hard to get into hospitals. So I don't know. My breast reduction will be massive. Well, we can do massive ones at Liverpool, Bex. We can do massive ones, but yeah. So, but if you want Birmingham, don't hold your breath. Who knows? It might come back. Yeah, doing great. Right. Who is Ella? I don't know, Bex, but I'm going to find out. Right. So Corinne's got a golden clinic passport. Yes, you have, Corinne. Faux show. Yeah, love a coffee. Thank you for explaining. You're very welcome. Thumbs up from Abs. All right, trying to. Hi, Mike. How are you? Oh God. Right. Oh God. Sorry. Nice to see you. I'm doing very well, thank you. So, right. Ella's putting a smile on your face. Yes. Right. What we got? All right, I got a question. Come on, let's do the question. He has blocked her now. I haven't blocked her. I can't block her. How do I block her? Don't know how to block her. She's on YouTube, you see. Don't know how to block her, Ella. Anyway, have a word. What is the difference in a mini tummy tuck and a full tummy tuck? Good question. So the difference is a mini tummy tuck is a smaller operation than a full, less scarring, less downtime, less complications, less cost. So a lot of people, maybe not a lot of people, but people do come to surgery saying, can I have a mini tummy tuck? I've got to be honest, not many people are candidates for a mini tummy tuck. And because although it is all those things for sure, it's also less skin removed and less of an operation. And I think there's a lot of people who want less downtime and less risks and less scarring. Well, to be honest with you, I do. I want less downtime, less risks, less scarring, less complications. I love it. That's why, I'd love it. These non-surgical stuff where you just put the thing on and cool the fat and heat the fat and all that sort of stuff. Brilliant. No, downside's less, but the problem is, in life there's a balance, and the less the downside, the less the upside. And so, it's all very well wanting all those things, which are noble to want, but you've got to accept that it's less skin removed and less less of a result. So the main difference, tangible difference from a mini tummy tuck and a full, is a mini tummy tuck only has one scar in the lower abdomen. There is no scar around the belly button, and the scar is shorter than a full tummy tuck. So it's usually in the same sort of place as a cesarean section, but it's longer than a cesarean section, but it's shorter than a full. A full tummy tuck goes from hip to hip, and a full tummy tuck gives you a scar around the belly button. And the big difference is that for a full tummy tuck, all of the skin from your belly button down to your pubic area is removed. And then we tunnel up to the rib cage, as I say, and then pull it down. So then we can repair the rectus muscle, repair the six-pack muscles, and we can contour the whole abdomen. With a mini tummy tuck, we don't do anything past the belly. We leave the belly button alone, basically. So you just take an ellipse of skin above the pubic area. If you've got a cesarean scar, sort of above there, sort of, people got like a bulge above the cesarean scar. It's good for that. It's good for flattening that out. But you're pulling down, and the belly button is sort of a fixed point, so you don't get above the belly button. So you can't repair the muscles, and you can't do anything to the skin above the belly button. So any laxity of skin above the belly button, and any laxity of the skin to the sides of the abdomen on the front, you can't really tighten that. So it's really just for a bulge above the cesarean scar or above the pubic area. So it's a limited tightening, but less scarring, less downtime, etc. So it's about, you know, what's best for you, really. Well, I know. Also, extended tummy tuck or JJ don't like 360. It's not that I don't like Bex. It's that it's quite a high complication rate with the 360. So it's just a spectrum. So I guess you got your non-surgical on one end of the spectrum where you know, no surgery at all, just put stuff on your tummy and destroys the fat somehow with the heat or the fat or the radio frequency or the cold or whatever, to one. Bye, Ella. Thanks for coming. Through to a 360, which is going all the way around. So it's a spectrum. And a 360 is a much bigger scar because it goes all, literally circumferential around the abdomen, and it has got more complication rates and more downtime, etc. So it is a big deal. So it's I think only certain people are really candidates for a 360, but in the right candidate, great, because it really does contour the whole. It goes all the way around the sides and around the back. Beautifully said. Thanking you. Does the Mons get lifted too? I'm very well, thank you. Busy, but I'm thankful, Jonathan. Good to hear, Mike. Miss Sindos, hi. To a degree, you're limited what you can do to the Mons specs. So you can, I wouldn't say the Mons gets lifted. You can try and take some heaviness out of the Mons, but if you have got a lot of fullness in the Mons, which is basically the area where the pubic hair is, then that might still be there. And it's really just a question of being aware of it pre-op, because certainly if you've got a big abdominal apron, you might not know that fullness is there on the Mons. And so you have to be aware that it's there, and we're limited what we can do to the Mons area because we don't want the scar to drift up. Lipo, yes, you can do lipo to the Mons, which will actually take out that heaviness. It won't take out the skin. So if there's ptotic skin, if there's a lot of loose stretched skin there, got to be careful taking out too much of that, because we don't want to go too far south. So we can do stuff to the Mons, but it is limited what you can do. I would hate to have flat tummy and massive Mons. Well, that's why we need a discussion. If you've got a massive Mons now, Bex, you might have a flat tummy and maybe not massive Mons, but a big Mons. So you're better off if it is a massive Mons, hashtag massive Mons. You might have to be prepared for another operation to tackle the Mons, because we're limited as how much we can tackle it at the time of the surgery. So yeah. Mike, what have you got? How does surgery work? If one was to try skin tag removal in a more private area, or is this a question best asked in your inbox? Either, Mike, it's fine. We can do skin tags anywhere, Mike. We plastic surgeons are one of those people who operate on any part of the body, pretty much. So yeah, doesn't matter where. That looks like massive emons. But yeah, let's get it. What's the word? Popularized. That's not the word, but anyway. I'm not down with the kids. There is a word, isn't there? But yes, Mike, you can by all means inbox me or email us, and we can just only do skin tag removals, any parts of the body, no problem at all. Can I have breast reduction and breast implants? We've done that earlier. So yes, you can, but I don't particularly feel it is a good thing. My wife doesn't know, but I'm looking at booking her in for weight loss surgery. How does a one-to-one consultation work for this? So, Mike, first of all, doesn't work well if your wife doesn't know. I don't think she would be happy about that, and the doctor would be a bit awkward about seeing someone who didn't know they were coming for a consultation. So I think you have to broach it with her at some point. And weight loss surgery is a completely different specialty. It's called bariatric surgery, and it's a subspecialty of general surgery. So I'm a plastic surgeon, so I deal with the sequelae of weight loss surgery. So I do with body contouring, tightening the skin once the weight has been lost. Weight loss surgery, things like gastric bands and sleeves and bypass and all these sorts of things, is a completely different specialty in another right. So it's not something that I would do. So you would have to look for a bariatric surgeon. So if you talk to your private hospital, your local private hospital, a bariatric surgeon, then that's the sort of person you'd want to be talking to about that sort of thing. But once he's had the weight loss surgery, then if there was any problems or any issues with loose skin, then that's when she would be seeing a plastic surgeon. So good luck with that. I had a skin tag on my neck. I used a kit off eBay. It killed it and dropped off. Okay. There you go, Mike. Bex got a kit off eBay. So, and Bex also had a gastric sleeve. And Bex says, tell him to talk to me. So Mike talked to Bex. Bex is on Facebook. She's saying you should talk to her because she's had a skin tag removed from a kit off eBay. I want commission on that eBay kit, by the way. I need a referral. I need a referral code for the eBay kit. All right. So anyway, no, it's fine. Mike, I could give Mike info. Bex can give you info, Mike. Cross-platform. So Mike on Instagram, Bex on Facebook. Introduce each other. Mike doesn't want the dodgy kit on his genitals, though. Bex, he doesn't trust it. Sorry, Bex, he doesn't trust his dodgy eBay kit on his genitals. So anyway, that's fine. It's the gastric sleeve she's talking about, though. She can help with the gastric sleeve and the bariatrics. You know, she's been through it, so she can. There you go. You can hook up with Bex about the that. There's a public service here. Yeah, I don't blame you, Mike. I don't blame you. I like that. So, do we offer skin transplants if a tattoo is not suitable for excision? Strictly speaking, transplants are the wrong word. I mean, that's for the plastic surgeons in the house. Hands up, how many plastic surgeons are watching this? Right, okay. So it's transplant. Trans means sort of across. So from one person to another person. So you wouldn't do a skin transplant. You wouldn't take skin off one person, put it on another person. So you would do a skin graft, a homograft. It would be the same person. So it wouldn't be a transplant. It would be a graft from one place to another place. Slightly semantic, I know, but anyway. So do we offer skin grafts if a tattoo is not suitable for excision? I personally, and this is I personally don't like the thought of doing a skin graft for a tattoo. Now, as plastic surgeons, we've all done a lot of skin grafts because burn surgery is a huge part of plastic surgery training, and the treatment of burns is skin grafts. So we've done a lot of skin grafts, and we are very familiar with using skin grafts. And skin grafts are a great way to resurface a large area of skin. So if there's a large area that needs resurfacing, classic example being a burn, cancer, something like that, skin grafts are brilliant. But cosmetically, they are not good. And that is the reason that I don't like them for tattoo excision, because to remove normal skin and replace it with skin graft from a cosmetic point of view, in my view, can be a little bit of a disaster. And so that's something that you would need to be aware of if you were thinking of that. And we get a lot of inquiries for tattoo removal, and the vast majority we say no to because they're too big, or they're in an area of the body where there's not enough skin laxity. And you could argue, well, what about skin graft? Well, I do know that my colleagues in the clinic, I work with a couple of other plastic surgeons who do feel better about skin grafts, and they do think about skin grafts. Now, I know, so you maybe could talk to one of them, but I'm not a massive fan of it, to be honest with you. And it would have to be some really completely non-cosmetic reason for having it removed, psychological distress, etc. Because if, from a cosmetic point of view, it will be a lot worse to have a skin graft. The skin's tight, the graft might not heal. It can take time for it to take. It looks unsightly, and it's if you don't like the look of it, it's very hard to do anything about it. You're substituting full thickness skin for a graft, which is much thinner and doesn't have the same laxity to it, doesn't have it often dry, uncomfortable. So for me, I don't like the concept of it. Is it an option? Yes, it's an option, but it's not a great one in my book. But as I say, the other plastic surgeons do feel a little bit better. Oh God, a little bit better about it than I do. And it's something to be discussed. There's no sort of rights or wrong with it. In the eyes of facts and factual information, do individuals who have a gender swap surgery, if they have a penis operated onto them, are they still considered a real penis or a fake one? It'll be a fake one, Mike. It'd be a fake one, and plastic surgeons are often involved in that sort of gender reassignment surgery. So it'd be a bit of tissue from somewhere else, often the arm. Use a radial forearm flap and put it to create a new penis, but it would be a bit of tissue from the arm or from some other part of the body, a tubed piece of tissue from somewhere. So skin graft, I could be a plastic surgeon, you could, Bex. My husband got run over, multiple injuries in his leg, broke in two, had to have skin took from his thigh like a cheese slicer, so thin, and grafted on his lower leg where bone had broke through. Yes. So that is, that's a skin graft right there, Bex. Couldn't have explained it better. Take cheese like a cheese slicer, so thin, and grafted it onto your leg. So yeah, that's where we are. Can I have a tummy tuck and upper blepharoplasty during one procedure? Yes, you can. Is it me, or does that feel a bit odd, having some sort of delicate upper eyelid procedure and then a tummy tuck? But on paper, why not? A bit like the skin graft and a tattoo removal. Why not? On paper, we need a discussion. But yeah, I mean, if you're having one anesthetic, upper blepharoplasty is a relatively simple procedure that can be done under a local anesthetic, so it'll be relatively easy to do it at a different time. But I don't see why not. Personally, I don't do upper blepharoplasty, so it wouldn't be me. You'd have another surgeon who does both. But I don't do any sort of anti-aging facial aesthetic procedures. But there are many surgeons who do tummy tucks. They do tummy tucks and upper blepharoplasties. So I can see no reason not to have a tummy tuck and an upper blepharoplasty in one go. But not by me. I wouldn't do it, but just because I don't do upper blephs. Oh God, what have we got into here? Watched a guy on TV, lost his penis to blood poisoning, had a penis growing on his forearm. It was very interesting. Yes, that's right. You use a radial forearm flap. Mike, what you got? I mean, I'm very happy to have comments. Are men able to have a larger one operated onto them? Not onto them. No, you can have it. You can have the penis enlarged. There's different ways of doing it. Not my field, to be honest with you. But there, you can be fat grafting to make the girth wider. and they cut ligaments and things to make it longer, but then it makes it less. I'm not an expert in this, Mike, but my poor cat had his tail amputated off. I called him. German guy nearby ran over her tail. Wow, we're getting into late night chat now. This is late night chat. The German guy ran over my cat. Right. Okay. So I think we've gone on too late. We're going to Graham Torrington's late night live phone in. So I think I'm impinging on Graham Torrington's territory here. So I'd like to draw it back to plastic surgery stuff. Arguably, this is still plastic surgery, but it's not my field. So I'm going to go and I'll tell you what, I'm going to have a lie down because I've been all over the place. I do like driving though, fortunately. So I've been up and down to the pool. And there you go. Why? You think? Well, yeah, thank you. That's very kind of you, Bex. Very kind of you. So I'm going to check out. But God willing, I'll be here next week. And until then, stay safe. Eat your greens. And Gaynor, I will be seeing you soon. Call me. Call me, Gaynor. Call me. Yeah? We'll sort something out.